On May 10th, the Centers for Medicare and Medicaid Services sent a new letter to state governors refreshing their guidance to the states as they plan for the eventual end of the national public health emergency. The letter actually does not provide any new information on when that end date might be. What it does is reiterate its commitment to providing 60 days notice in advance of that eventual end date and providing a refreshed listing of resources that states can use as they're in their planning phase right now. Now, the last time we heard from CMS sending guidance to the states, it was in the middle of March of 2022. And that guidance gave the states more time to do the transition out of the national public health emergency for all of those individuals that had been held in continuous Medicaid eligibility during the ongoing pandemic. It extended the amount of time that states had to do their renewals and reevaluations of all of those Medicaid enrollees. This May letter to governors has provided 2 pages of tools and resources to support states in planning for the public health emergency unwinding and the return to regular operations. And they categorized their resources into 4 broad categories. First of all, guidance related to returning to routine operations after the national public health emergency ends, planning tools and templates, strategies to support and streamline state unwinding efforts, and a listing of some communication tools. Now, as a condition of receiving enhanced federal funding, like we said, states had been holding individuals in continuous Medicaid eligibility, and that's been going on for about 2 years now. The Kaiser Family Foundation has actually issued a new report about what the impact of that actually looks like. And they said if the continuous eligibility runs through 2022, just as an estimate, that means that we've got about 22.2 million more Medicaid enrollees than we typically would have had. Now, if continuous eligibility were to end in the middle of 2022, they say as many as 5.3 million up to 14.2 million people could actually lose their Medicaid coverage. So taking the time to plan and strategize now is important so people don't lose coverage. They are instead transitioned into appropriate coverage. So as we learn more about the national public health emergency, we will continue to provide you with updates on this channel. In the meantime, you can read some of those resources we shared today, the letter from CMS and that Kaiser Family Foundation report.